it's incredible to see so many anti-professionals giving up their time to collaborate together and learn from each other. And that is really rewarding.
Key takeaway of this conference for me is all around. We had a stand which Glenn Hodgson really kindly agreed for us to have, and it's been fantastic to bring people together. Yesterday we had almost 100 different trusts that had come, different people from different trusts come to the stand to talk to us about how do I ... where can I ... who is doing ... That makes a massive difference, because once people on the ground understand, they're the people that write the business cases, they're the people that then lobby for funding, they're the people that raise it to the exec board. By raising the awareness, we change the outcomes. It means that we get things done. So that in itself, it's all the small steps that go towards the building blocks, which then build new hospitals. And that's why it's really important. That for me is the big takeaway.
Loads of great work across the piece, and people are really keen to try and get this standard working. And I think that's the beauty of coming to a conference like this. You can see people across the country and across the nations working really hard to get this done. So it's very invigorating to see all this work that's being done.
I think the key takeaway is, as you said, how much we've moved forward with the standards. And previously was all nice to have, a possibility, but now it seems to be a lot more tangible and is happening in a wider industry and a wider application. So that's the takeaway. It's good to see that how far we've come with the standards.
I think for me it's always the benefit of sharing practice, sharing challenges, sharing success, making sure that everybody is aware of what's going on across the NHS, UK-wide, particularly important across all the home countries, what everyone is doing to develop and take forward the agenda.
It's been a great day at the GS1 conference. There are many takeaways. As I often say to my team and reflect as a leader, this is about continuous improvement. There are many areas where I think that's a lesson we can learn. It's to continue to instill the virtues of why GS1 is really important and help that change management and culture, leading from the front in the organisation to make sure that scan for safety using the GS1 barcode is really important, and we must continue to drive that and make sure that's well understood in the organisation, particularly for the benefits of patient safety, as well as tracking person, product, place and process. And I think if we do that, and we all do that, we will ensure a healthier, safer healthcare system.
So I feel a sense of hope. I feel a sense of inspiration. It has been wonderful being in the company of like-minded individuals, and I suspect to some extent the work to be done is not in this space, it is outside this space. I've made a few connections, so GS1 standards are all about connections, and actually I've made a few human connections, and I can see the next few steps that we can take around one ambition which I hold dear, which is to have GS1 adopted across all London provider trusts.
Collaboration. I think clinicians, IT people, organisational individuals, NHS England, everybody needs to get together to apply the GS1 standards uniformly everywhere.
My key takeaways relate back to what I said. We've made so much progress. We have so much further to go. We have a lot of work to do with the patient community and making what we do in Scan for Safety standard across the NHS. But my main takeaway is people are working on this. This is a priority, and it is totally agnostic in terms of any sort of shift we're seeing at the centre of the NHS.